Well, Suboxone is meant to help wean people off opioid dependency with the promise of more like a bright light at the end of a very dark tunnel of addiction.
When left in the wrong hands without proper oversight, it can be prescribed chaos.
It's strongly abused, heavily abused. One of the most abused prescription narcotics we have in this county.
News Channel 11 tackled Suboxone's intended use and growing abuse in the Tri-Cities 1 month ago, and that story generated a lot of talk. Tonight, News Channel 11's Kylie McGivern takes us inside a Suboxone clinic and the lives of 2 recovering addicts on both sides of a double-edged drug.
I was a drywall man, and I had injured myself.
They prescribed me the opiates after he was born.
Both paths were paved similar enough for Amy and Sam, painkillers taken with innocent intentions to feel better. But soon, both began feeling lost without them.
I was selling everything I had.
I am addicted, it hit me. And since then, I mean, it's been just a downward spiral.
They're 2 addicts working to reclaim their lives at different mile markers on their road to recovery. Amy is now 5 months clean.
It's really hard.
And Sam?
4 years sober.
Suboxone has played a role in each of their journeys, but that is where the roads split.
It just cleared my mind up.
Wish that I would have never put the first one in my mouth.
Families Free Director Lisa Tipton requested we conceal Amy's identity, as she's currently in one of the organization's recovery programs.
Every time I would get high off of it, I would crave everything. I could get my everything. I've withdrew off of Suboxone so many times.
Suboxone is the brand name for a combination of buprenorphine, an opiate, and naloxone.
Naloxone is added so that people do not take the Suboxone tablets or the films and inject them. The naloxone would make them go into withdrawal.
Because of that, Sarah Melton with the East Tennessee State University's College of Pharmacy says Suboxone is less likely to be abused than pure buprenorphine, which is being sold under the name Subutex.
It's very commonly injected up in Appalachia.
Federal numbers show Tennessee has more doctors prescribing buprenorphine per capita than any other state in the Southeast, aside from Kentucky.
We have some of the highest overdose rates from opioids in the country.
Treatment in clinics prescribing buprenorphine or Suboxone are supposed to include counseling with a certified substance abuse counselor, group meetings with patient support, Narcotics Anonymous and Alcoholics Anonymous meetings, regular drug testing, cross-referencing the controlled substance database, and
they're not going to be prescribed other controlled substances like benzodiazepines.
But reality is falling short in many cases.
Both times I was prescribed Klonopin, a benzodiazepine. Everyone I know did.
Most of the women take 2 and sell the other 2.
Only federally authorized doctors can prescribe buprenorphine, and currently there is a 100-patient limit for each physician. Visits to Suboxone clinics average $100 per week, many times cash only, not including the cost of medication. So 100 per week from 100 patients, that's around 40 grand a month.
There is a lot of money involved.
According to the New York Times, Suboxone generated more than $1.5 billion in 2012, trumping the sales of medications like Viagra and Adderall. Dr. Tom Reach stands by the drug's benefits. He knows firsthand the power of what he calls the soul-swallowing, life-threatening disease of addiction.
Back in the 90s, I ended up getting involved in hard drugs, and I ended up losing my medical license.
Suboxone came out on the market in 2002, after Dr. Reach got sober, but fearing its stigmatization,
Treating addiction is the solution, not the problem.
he invited us to his clinic, Watauga Recovery Center, a strong advocate of the 12-step program.
Lumping everyone who prescribes this medication into one category and painting a broad brush is missing the significance of the fact that it is the most effective treatment for narcotics addiction and that it's saving lives.
Sam Campbell is one of his patients.
Oh my gosh.
And knows that better than anyone.
I wouldn't be here today. I'd be dead. I was able to take 10 to 15 Percocet 10s a day. I didn't have a car for 3 years. We walked because of addiction.
Sam is still on Suboxone, which he credits for now having a car, his family by his side, food on the table, and a hunger to live the life he thought he'd never get back.
I wouldn't be here to spend the next few years, the rest of my life. Hopefully I got a few more.
A few more.
It's actually bad company.
Without the bad company of addiction. And when I reached out to the Tennessee Department of Mental Health and Substance Abuse, I was told in our conversation that they're actually very close to unveiling a new strategy to prevent and treat the prescription drug abuse in Tennessee. And that information is expected to be released sometime this summer.
Kylie McGivern. Kylie, thank you.